Pop quiz 118. A woman's hospitalized with a diagnosis of bipolar disorder. While she's in the client activities room on the psych unit, she flirts with male patients and disrupts unit activities. Which of the following approaches would be most appropriate for the nurse to take at this time? 1. Set limits on behavior and reminder of the rules. 2. Distract the client and escort her back to her room. 3. Instruct the other clients to ignore this behavior. Or 4. Tell the client that she's behaving inappropriately and send her to her room. And the correct answer, guys, is 2. Distract the client and escort her back to her room. So she has bipolar disorder. What we know about the bipolar disorder, there's two severe ends of the spectrum where the patient can be severely depressed or they can be in a state of hyperexcitability, right? The fact that she's flirting with the nurse or the male clients, I should say, that lets us know she's in the manic phase. She's in that state of hyperexcitability. So whenever that client is doing something they really shouldn't be doing, if it's not putting themselves in danger or anyone else, what you want to do is distract them or reorient them. You're going to kind of treat them like you would, the Alzheimer's or dementia patient when they're getting into something they shouldn't. All you have to say is, oh my gosh, look over there. And they're going to stop what they're doing and they're going to look, and then you just reorient them. That's kind of how you treat them. Same way. Now let's talk about the wrong answer choices. 1, setting limits and reminding them of the rules. This is something you would do more with that patient with antisocial personality disorder. Remember how everybody thinks antisocial personality is someone who doesn't like people. But clinically, that is not what the diagnosis is. Someone with antisocial personality disorder, they love people. Why? They're con artists. They love to manipulate people. They're like social chameleons, right? So you have to set very strict boundaries with them because they will try to get one over on you and the staff. So that's for number 1. Choice number 3, instruct the other clients to ignore the client's behavior. Absolutely not. You never subject your other patients you never allow your other patients to be subject to inappropriate behavior. You don't tell them to just ignore it. You have to address it. Choice number 4, tell her that she's behaving inappropriately, send her to her room. Number 1, that's too confrontational. And number 2, most likely, all that's going to do is cause that patient to be more agitated. What you want to do is kindly distract them and reorient them. Number 2 is the correct answer choice.